Okay, our third presenter, Andi Rosnita binti Kandi. She will present based on the topic, the effectiveness of cupping therapy as an alternative way of treating common ailments. So what conjures up in one's mind when the term cupping therapy is mentioned? Well, cupping therapy is a traditional treatment. It is said to be first used by the ancient Egyptians. So many find it remarkably effective in the curing health problems. So now I'll pass the time to her to further explain to us.
Thank you, Ms. Speaker. And Assalamualaikum and good evening to everyone, especially the examiners and all my friends here. Okay, today, as introduced before, my name is Andi Rosnita binti Kandi, and I am one of the final year project students for Diploma in Biotechnology that have gone through my research project almost 3 months, and my title of my research project today is the effectiveness of cupping therapy as an alternative way of treating common ailments or diseases. Okay, and for your information, my supervisor is Mr. Gopal. Okay, here at Pusat Bekam Aini at Bandar Baru Bangi, where I conduct my research, and Puan Noraini there is the one who the founder for this my research center. Okay. Okay, what I will talk about today is I will introduce to you a little bit about the alternative treatments to get the idea to you what is the actually alternative treatments, and cupping therapy as what I chose for my research project, my research objectives and methodology, how to perform the cupping treatments, and my results and discussion after go through my research project, and what I can conclude from it. Okay, a little bit introduction about alternative treatments. Okay, as maybe one or most of us know what is actually the alternative treatments. Alternative treatments actually we also known as traditional treatment or therapy, and have been used since more than 1,000 years by a lot of community or society in our world. And alternative treatment actually one of the another choices that we can choose for treating or healing process of our sickness, rather than choosing the modern or conventional medical. Okay, there are so many types of alternative treatments like acupuncture, aromatherapy, cupping therapy, massage therapy, and psychotherapy. And for my research project, I chose cupping therapy. Let's move on. For cupping therapy, actually it is, like I mentioned before, a kind of alternative treatment. This is the safest method to detoxify the blood, as the process is by removing blood that containing toxic or dead red blood cells in our body. Then it is have been used a few years, 1,000 years ago by the Middle East, Chinese, or the Europe society. The process is by stimulating to our immune system, hormones, and lymphatic fluids. Okay, it is actually by triggering the points which I will show after this. It will give the natural healing process. Okay, there are several types of cupping treatment, but what I will show to you today is about the first two. There is cupping therapy and blood therapy. Okay. Okay, what I have told you before, there is a few points that we can use as the cupping points. You can see here the red dots here. It is actually each point will be used to treat either one or more than one diseases. And maybe for one diseases, we maybe need to use several points to be used to treat the sicknesses complete. Okay, for example, here is paranasal sinuses. Paranasal sinuses actually the area, airfield area between the bones of our face and skull. Okay, there is the airfield there. And by triggering or putting the cupping cups at this area, highlighted area by that I show you, by putting the cupping cups and triggering that area, we can we can cure the sinusitis, allergy, and flu patients. Okay, to make you clear with how the cupping cups be placed like this. Okay, to treat the sinusitis patient. Okay, at my research center at Pusat Bekam Aini, actually there are a lot of sicknesses treated there. For example, allergy, asthma, gout, high blood pressure, low back pain, migraine, shoulder pain, and stroke, tiredness. But due to lack number of volunteers or patients for other sicknesses, therefore I just choose low back pain, migraine, and shoulder pain for my research because of the number of volunteers is much higher than the other sicknesses. Okay, migraine. I guess most of us, or maybe one of us, have experienced how the feel of migraine, having migraine. Actually, migraine will happen because of when we stress, the peptides, the central nervous system will release the peptides that called calcitonin gene related peptide. This peptide will cause the blood vessel to dilate or swelling and produce an inflammatory response, which will cause really sensitive to pain. Okay, then the swelling, the dilate blood vessel will will produce an electricity wave, which will enter the brain and ripples across the surface of the brain. Ripples across mean it will conquering all the trigeminal nerve, and especially the one side of our face. Okay, shoulder pain. Okay, shoulder pain actually the major causes because of the injury of the soft tissues and muscles, and degenerative disease. This also can cause the shoulder pain. Not only the back side, but abnormalities happen on the front, especially the abdomen, heart, lungs, and some abdominal organs also can causes the shoulder pain. Okay, and just a precaution: sudden movements or heavy loads can cause the inconvenience. Disorders occur to the spine and will cause the shoulder pain. And lower back pain, this is the disease or injury to the muscles, bones, and or nerves of the spine. This is always happen to the sportsmen, okay, because of the injury. And abnormalities same as the shoulder back pain. As shoulder pain, the abnormalities of the front organs also can causes the lower back pain, and infection, of course, will cause the lower back pain. Okay, my research project objectives are to investigate the effectiveness of cupping therapy in healing general sicknesses, and to identify the most cured sickness through cupping therapy among the chosen disease. Okay, to perform cupping therapy, we should have a few equipment. There are, as you can see it here, this is we call as lancet device. If we don't have the lancet device, we can replace it with laser. This is cupping cups and the pump, massage oil, alcohol swab, disposable hand gloves, antiseptic liquid, and tissue paper. Okay, and how to use all this, I will show you here. Okay, first of all, we need to prepare all the equipments needed. But since I'm not the certificate practitioner, I just can show you the dry cupping therapy is by first we need to choose the points that we want to put the cups here. Let's say I choose this area, then yes, sure. Okay, let's say I choose this side as the points. Okay, the trigger point or the acupressure points here. Then we massage it for a few minutes or few seconds to soften the skin. Okay, to soften the skin and trigger the nerves there. Then we choose the suitable size of cups. If you choose this is too large for this area. Then we choose the smallest one. Then by putting this on the points that we choose, then use the pump to make 2 or 3 pump. Okay, sorry. Okay, just leave it for 2 or 3 minutes for the blood to get all the toxin to accumulate under the skin, just under the skin. Okay, until the steps is called dry cupping. Okay, this is blood cupping. Okay, blood cupping is much dangerous for those who are not have certificate to practice it. Okay, first after the suction, we have to remove the cups. Then by using alcohol swab, we apply it there to kill the germs that will cause an infection. Then by using this, either the rinsing device or the razor, we make a micro cuts there to make a hole to let the blood, the toxic blood come out from the area. Then we put back the cups to suck out the blood. Then we just leave it. Then this is the blood, and we use tissue to wipe it. Okay, to get you the image. Okay, this is the points that we use to treat migraine. Actually, there's the okay. Migraine. This one for shoulder pain and lower back pain. Okay, I will show you some the videos how the toxic blood been removed from the patient of shoulder pain and lower back pain. As you can see, the cuts here. The cuts here. We have the cuts here to let the place to blood go out. Okay. The sticky blood actually that containing the toxic. Okay. When the vacuum pressure applied to the area, it will remove up the toxin and that blood cell. Okay. Everyone get this? At this process. This so after go through that, okay, this is the data, the table for my research, okay, and to make you can see it very clear, I put it in a graph. Okay, this is the graph of for migraine patients. Okay, this is the pre-treatment, which means before the treatment, and post-treatment after they go through the treatment. And p-value here means the significant differences, 0.0217, which means it is below 0.05. That means these patients, the patients for the migraine show the significant difference, and the effectiveness is really effective. Okay. Okay, as you can see here. Okay, shoulder pain also shows the same result as migraine patients because the p-value or the significant differences value is below 0.05, which means this treatment also really effective to treat the shoulder pain patient. And for the lower back pain, also the same, but it's really much lower than the other two, and which show that lower back pain patients also have the significant decrease after go through their treatments. Okay, from all the figures that I showed you, okay, the value for migraine, shoulder pain, and lower back pain are 0.0217, 0.0105, and 0.028 respectively, and all of them show the value of significant difference less than 0.05, which means that all the treatments have cured or reduced the pain of all the patients, and the most effective significance was the lower back pain, and this is due to the acupressure points have been triggered more compared to the migraine and shoulder pain areas. And as the conclusion, I can conclude that among the all of the three cupping treatment really can cure all the sicknesses, and between the three, the cupping treatment really can work well on healing lower back pain. Okay, I just suggest that we should have more further study in this topic by giving more time and more volunteers to get the much effective results. Okay, that's all from me.
Okay, examiners, you may ask a question now. Begin from Ms. Hamida. What about Mr. Ho?
I don't have a question. Very good. But I have two comments. Right, you should include understandable pain scale. Because what you said, when you include in your examiners pain scale that you mean by the condition is 5, 6, 2, 3, but you do not know what is mean. Right, so we should write like right? So the one is possible right equivalent to that. You obtain like equivalent to giving birth to a baby. Hence, right? So, but that also different from male and female because guy doesn't need to give birth to the baby. So they don't understand what is hence scale can do, right? So it will be equivalent to a short by a minute. Right? That is very cool. So 4 to 5 will be all between of that. Between hospital bike and sequel or maybe that is more acceptable. Right? So second is the result is quite subjective because everyone receives pain differently. Like some of us when we chop things when we are preparing food, right? We chop the fingers. Some people say there's nothing. Some people they are flying, screaming everywhere, right? So that is very subjective. And we should need a very large sample size to get that. Else we wouldn't be very good. Right? So let's do this. The question?
your reading from literature, is there any study regarding the blood clotting after the treatment? Are they checking the toxin or items like that? So far, there are still in arguments how the blood will look like, because most of them just containing empty and not can be used anymore. Blood. The high the containing of toxin also high in the blood. So compared to the normal blood, that one the blood after the cupping contains a lot of toxin, so they have already show the proof. Another thing, rather than detoxification using cupping therapy, and is there anything like drinking or eating can detoxify? Simple method. I guess there's some methods, but as I mentioned here, my research only focus on cupping therapy. So how the cupping therapy works is what I am focused on. So you're suggesting the cupping therapy is the best method, right? Then another one can place the patch on the foot, right? The Japanese, the patch one. Also the detoxification, right? But it detoxifies from the sweating. Cigarettes, to sweat more, then the toxin will come up with the sweat. The patch lah. This one they suck out from the blood. Can consume less time than using the patch to detoxify fully from the patients. So how long they put the cup at the patient? How long? Is it 3 to 5 minutes? 3 to 5 minutes finish the detoxification method. For the first stage, that is why the patient will ask to come again to make a follow-up treatment.
All your patients, all the volunteers here are in the same stage or in a different stage?
Most of them have gone through 2 stages of treatment.
But not all.
Yeah?
But not all of them. Making the skill is quite varied.
Yes, most of them, but not all of them, because once they feel healthy rather than before, they just didn't come up for the next treatment. And then your patient, the age, for what limit? I have no limit in the age for my patients, but that's why I said as my limitation there, the number of volunteers, and maybe when I have more volunteers, maybe I can classify them either by gender or by the age. So now, can I know what's the age of the patient? Mostly we are starting from 20 until 50.
You cannot get the data from the site itself. You must keep the record on the patients. You can limit your patients between from age 20 to 30, and then you can classify 20 and 40.
This is only the patients that come during my research time.
But you must have records, am I right? Is it confidential?
She's supposed to, that's confidential only. The other thing is you're supposed to get the treatment, the skill, you know. So that's why. So if I feel the patient already gone through the stages, right? That means you cannot ask the patient now how you feel before, right? So that's the reason she only choose the patient during the research. Actually, she need a pain skill for her research. They will provide pain skill.
Yes. It's not really painful. It's fun.
What I feel just now, right, is like when you do this to me, that there is a pressure build up within this thing, right? So it just covered the pain that I felt before. Like one thing is like, I give an actually give example. It's just like when you eat chili, you feel a very spicy feeling sensation in your tongue. After that, you eat a spoonful of wasabi. Then you feel nothing for the chilies anymore. Yeah, it's just like pain. Yeah, like I have pain in the shoulder. It's more painful than the shoulder. Right, so that's the case.
The pain that you feel only just for a while. Then after the cover, then you can recover inside. Then
The shoulder pain come back.
no, the feel they are good than much better than before.
Because there is one person that is dying or shoulder pain before the treatment, there will be grade 4, right? Grade 4. Then after that, you don't feel pain anymore.
Zero.
Yes, 0.
Zero pain for his sicknesses. Yes.
You should try, man.
So I think that's the reason why
It's very effective. I should say it's very effective compared to that the other one. It was thank you.
Okay, any questions from the audience?
No.
Oops, we have two. It seems we have two. So maybe ladies first.
Okay, for migraine treatment, right? Those the person or the patient should become dog.
Yes.
Become dog.
Oh, only
Because
for
I
the
see it's like got females, right? Got hem. So because if you direct contact with skin, the pressure is different. If you
okay, as I showed you before. Just the cupping area. And you share the cupping area, but it is by the patient's own choice actually. If you don't have the upper area, this we can use this point. But the time consumed maybe longer than we use the points above. Okay. Any question?
Yeah, my question is this. When the blood is extracted from the skin, does it mean that that's already solved the problem, or they have to go through series of coupling therapy
To really heal the sickness?
yeah, to really heal?
Okay, actually, by done the first treatment, actually it will just only cure a bit. Okay, and the patient are advised to come again to see how the treatment will really cure the sickness that they feel. Okay, if they doesn't feel it anymore, then if they want to come, then they can come. Then if they choose not to come, then they just come. This is the only the patient choose twice.
Okay, but if you remove blood from the body all the time, is it not going to affect the health?
Okay, as I mentioned before, this is not the healthy blood. Okay, this blood actually that containing the dead red blood cell, the toxic one, and that can be used anymore. Okay, by the vacuum there, the vacuum pressure, it will just pull up the toxin that accumulate under in our blood, the healthy blood. Okay, to make our blood circulation more healthy.
Okay, any more questions? Last call.
Next.
No, I mean like what you
I
asked.
took of the clip.
I asked you, let's say you use this in one patient, right? Then let's say second patient, would you be using the same thing or you want to take this?
Once I have
They just wash it and rinse it with warm water and inside.
because when they're dealing with blood, people is very worried about it.
This one, is this possible or useful?
This is the plastic one only for the dry cupping.
So that means what you want to keep cutting it to use the dry or the blood?
Glass. I'm not.
Because when they're dealing with blood, so there might be a transmission.
This is the traditional way. Just before
I think
the.
they use it for that too. They don't have a special things like this.
But I think the fire one. repeat. No. Just remove the oxygen.
Thank you. Thank you so much.